A friend's husband needed a kidney transplant. To qualify, they went to Human Gokot's flagship company, the non-profit health system that is really all about profit, to go through a massive battery of tests, evaluations, poking, prodding, social worker and psychological evaluations. The process takes a while. After they get cleared as a potential Astra's candidate, they have one final review, that by the transplant surgeon himself, who decides if he will accept the case. This is all done before they are even placed on the waiting list for an organ, so it might be years between being accepted and actually getting a kidney. The surgeon came in for the meeting, which took less than 10 minutes. Most of the time was spent explaining how there is a federal database that tracks the number of successful kidney transplants vs patients who die for each doctor. The doctor was quite blunt. I do not accept anything less than perfect transplant candidates because if there are any problems it affects my numbers, and they go down, and left the room. A week later the official decision came from the transplant committee: transplant denied, unsuitable candidate. They then went to the teaching hospital affiliated with the hospital and were accepted as a transplant candidate immediately. They were told that they had many perfectly appropriate transplant candidates who had been rejected by the big hospital because they cherry-picked the absolute best possible candidates to make themselves look good and sent everybody else home to die.